Hello, I'm Leah Binder. I'm president and CEO of the Leapfrog Group, and I'm very pleased to be joined today by Riot Curry, who is Vice President of Quality and Patient Safety and Clinical Value at Valley Children's Hospital in Madera, California. Valley Children's Hospital has been a Leapfrog top hospital for 3 years, 2019, 2020, and 2022. Leapfrog's Top Hospital Award is an elite award, is a difficult award to achieve, and it represents the best of the best in quality and safety among the participants in the Leapfrog Hospital survey. Today, we're going to learn more about the improvements that Valley Children's Hospital has seen in their own quality and safety as a result, in part, from participating in the Leapfrog Hospital survey. And we're just curious as well to hear more about how you're doing in the world of pediatric hospitals, which is so important to all of us who, as parents. So thank you for being with me.
Thank you very much, Leah. I appreciate the discussion this morning and the collaboration with Leapfrog.
So tell me about, tell me what caused your system to embark on this journey as being part of Leapfrog?
Thank you for the question. Our journey has really begun with our mission and inception 70 years ago, which is to provide high quality, comprehensive healthcare services to children, regardless of their ability to pay. And to support this mission, our vision is to provide the nation's best healthcare for kids and become the nation's best children's hospital. And with that, we set out best goals for ourselves: best in quality, best in access, efficiency, customer experience, best people, and philanthropic causes. And Leapfrog has many of those goals that help support and align with our journey to become the best children's hospital, to eliminate harm, to provide the best quality across the nation.
Can you give us some examples of measures or measures within the survey that have been particularly important to you?
Absolutely. First and foremost, the safety measures. Because when you look at quality, there are 6 pillars of quality, but safety is the one that really is most evident. And the central line infections, the urinary tract infections, the Clostridium difficile, all the healthcare acquired infections, those have contributed to longer patient stays, mortality, cost to the healthcare system. So those are very critical for us to eliminate completely. That's elimination of preventable harm. Patients should never get those things when they come to the hospital.
And did it help you in reporting to the Leapfrog survey? Did it help you to identify those areas where you needed improvement?
As with many other journeys we've engaged in, whether it's our magnet or the boulders that we're on today, anytime we engage and report the Leapfrog, we become better because it allows us to self-examine and look at best practices, collaborate with other hospitals, top children's hospitals that are there. Obviously, the first thing I do is look at who else is in the region that have become a top hospital, and try to communicate with my peers over there and see what best practices are still there that we have not, embarked on. So I think the collaboration, the networking, allowing us to get familiar with what other best top children's hospitals have is great. Very valuable for us.
And I assume you're open to anyone from a children's hospital watching this video, if they want to reach out to you as a top hospital leader, that they can do that.
Absolutely. And one of the collaboratives that we are also involved in is the Solutions for Patient Safety. Almost all of our pediatric hospitals, they would know what the Solutions for Patient Safety collaborative is, and it is an all teach, all learn approach, and that's the approach. Absolutely, we will never compete on safety or quality. We will teach and we will learn from our colleagues with that. So I think that's absolutely, the invitation
Right,
is open.
the children come
Yep.
first.
Yep, absolutely.
How did you persuade others in your system, other leaders like yourself or your board, that it was important to report to the survey?
Well, obviously, the involvement of the board and senior leadership is critical in the success of any initiative. And our board and senior leadership is very, very keen and involved in quality and patient safety. They all have received the Solutions for Patient Safety Board training. Quality and patient safety is one of the top agenda items in any of the meetings that we have. So really, it didn't take any convincing. They are really directing the ship and where we need to be in terms of quality and patient safety for Valley Children's. So I had a very easy job here.
Well, that's heartening to hear. Did you hear any concern about the transparency of Leapfrog? The fact that Leapfrog reports by hospital?
In the beginning, long time ago, that always is there is a transparency there. There is a concern about lawsuits or things like that. But we really have demonstrated that by being transparent, we get better. And it takes a while, as with everything else. Culture does take time to change. But at the end, transparency will help organizations get better and will help all of us to get to a place where we eliminate harm. And preventable harm is no longer part of the vocabulary that we use. And that requires transparency. If we don't show what we have, how are we going to improve?
Right. I think obviously from where I sit, from Leapfrog, transparency is extremely important to us. But I will say that I feel like it is the indispensable first step in a journey toward safety and quality is transparency. But it's hard because as humans, we don't always like it. It feels uncomfortable sometimes, but it can really make a difference. I'm glad to hear that has made a difference for you.
Yeah, and it does build, that's the foundation of trust, and how you get better is when we're able to talk about, the mistakes in an unblamed environment, which is critically important. We're here to learn and teach and improve. And, as many of the research and literature have shown, is that it's never an individual fault. It really is a system issue. And the average is about 6 or 7 mistakes have to happen with the system before really the end product becomes, the harm to the patient. So it is, the transparency brings us to identifying and illuminating the system issues that we need to address. And it's never an individual. And sometimes I think in the past, where that you blame, most organizations would just blame the individual rather than the system. And they really haven't moved any of that. And, James Reason's research, all of the Lucian Leap research, all of the research out in there have shown that really systems are what cause the issue in 99% of the time. And in order for us to improve them, we have to shed light on that. And for that to happen, we have to be able to transparently discuss our faults, discuss our issues, and learn from them and become better. So I think we've embraced that a long time ago, and it's really working well for us.
That's really interesting. So you think of transparency as a critical element of really a just culture, of really understanding the systematic issues that are involved in patient harm and getting away from that individual blame orientation that is so damaging really to improvement. That's great.
Absolutely. And you have to demonstrate that from the highest levels up. If we want our staff to tell us the issues, we have to demonstrate that, and we have to model that way for our teams, because they're the ones that really know where the issues are and how can we fix things. And we have to demonstrate that. And I think we spend we really focus on that here at Valley Children's to create a psychological safety for all, where we learn from our mistakes and improve and become better. And we, year after year, we get better and better and better, and it's just infectious in
And
a good
it's
way.
psychologically safer for patients and families when you're transparent, because it's incredibly reassuring to know that even if all the results are not perfect, which they never are, it's reassuring to know that there's such a strong commitment to absolute candor.
Yeah, absolutely. And then to share with you, I mean, years ago, we began having patients in our committees. This is not something new. We've had patients in our, sepsis committees, our performance improvement committees, patient safety committees for years and years and years to elicit that the patient response, the patient's point of view, how others, on the consumer side, look at what we do. And believe me, we have learned a lot from a non-healthcare provider point of view of how to get things, a little better, and what it means to a teacher or to the mother of a child or something of that sort. So, we've learned that lesson a long time ago, and it has provided us with a lot of valuable information from the patient side.
Do you coach patients and families on how to participate in meetings like that? I mean, I've heard that sometimes people might feel intimidated if they're not a clinician, but they're sitting in a room with, physicians and nurses and who sound like they know lots more than they do. And
Leah, we don't coach the patients. I meet with them before the meetings to kind of go over what we're going to talk about. The coaching happens for our team, meaning that the language they use, it has to be simple enough. So, we use a lot of acronyms, and sometimes I make sure that, that the rest of the committee understand that may intimidate a patient's family or a patient that doesn't understand. So please help explain what that means. So I think simplifying the language a little bit, so it's more of the teams versus the patients. And we have really...
I love that answer. Yeah. Because you're basically saying, no, we have to be coached.
Exactly.
Because the centerpiece really of the work is the patient. So we have to be coached to interact with the patient in a way that's most productive and meaningful.
Absolutely.
That's exciting. That's wonderful. It's great to hear. So what advice do you have for other pediatric hospital leaders who are interested in survey participation or just in a general sense to get better?
I was thinking about that, and the best quote I have really is your quote. So I'm going to quote you, which I think you said, it takes leadership, teamwork, and absolute dedication to patients to achieve this award. So I think that is the advice that I have for other leaders. I also encourage them to become transparent, to really pursue all of the improvement activities that are available there, because in that pursuing of that, award or the designation, your team becomes better, because it's not the award. The award is, just the icing on the cake, if you will, but it's the journey that this award takes you through, how you get better. So if you take each indicator that, for example, if we only focus on Leapfrog, each one of the indicators has to have a strategy for improvement. Right. And it's not an overnight improvement. It takes years and years and years, but once you get there, it that's an improvement forward. So I think that's and never, be patient, work on your teams, and continue with the journey to excellence, because we owe patients nothing less of excellence. That we need to cure patients. We should not harm patients when they come to the hospital. And preventable harm should be something from the past, where our kids should never have to deal with that. And we can achieve that if we do. And we've proven the improvement that we've done over the years, that we are getting into a point where that can become a reality.
Well, it is really heartening to hear you say that. I say that as a mother and who cares deeply about my own children, but also other people's children in this country. And it's just exciting to hear of your leadership and your health system's leadership. It's just extraordinary. And it is one of the great privileges of my job that we are able to offer you an award and recognition for that with our top hospital program. And it's also a great privilege of our job that we don't issue it forever. We issue it for 1 year. And each year we expect to see you back, as we will next year.
Absolutely.
With really superb results and for your patients, which is everything that matters.
Absolutely. And I thank you very much, because it's continuous improvement. So we have to be better tomorrow than today, and the day after than tomorrow. And that's the approach we have to take. And until we get to zero, until we eliminate the preventable harm, we may be getting better, but we're not yet at where we want to be, which is elimination of harm. So I'm also in support of that strategy of it's 1 year, and then we have to continue to improve to even qualify for.
And we hope to give you those milestones and those celebration moments.
Yep.
Because you really do want to stop for 1 minute and just celebrate when you've achieved something, or reflect and say, well, we didn't get there, but here's how we're going to. But there has to be milestone moments, and that's all part of excellence. And so I am I'm deeply grateful to you for your leadership and for being part of Leapfrog, and for really inspiring all of us at Leapfrog on what a difference it can make when leaders like you are committed to their patients first, last, and always.
And I thank you as well, Leah, for your leadership with the Leapfrog group and making sure that you hold us accountable to those higher standards and demand that excellence should be a given and not, something that we should take lightly. So I thank you very, very much for your leadership and for helping organizations across the board get better if they choose to.
Thank you. Thank you, Riot Curry, our guest from Valley Children's Healthcare, with a fantastic story to tell and an inspiration, and welcoming others who are interested to contact you. So thank you.
Thank you very much, Leah.